Hi everyone, Julien here, nurse practitioner for Dan Aesthetics Medical, and our clinic is located here in Ottawa, Canada. Last week, I showed you how I volumize a feminine client using dermal fillers. As a follow-up, this week I'm going to show you the exact same thing except for a masculine client. There are slight differences here, and the amount of volume is very important. So let's get into it. I'm very excited about this segment. All right, so before we begin, let's bring in our assistant, Stuart. He's going to cover some essential anatomy tips for us. Essential anatomy tip number 1, avoid hitting the facial artery. Why? Because it's the biggest artery on the face, and at the same time, it connects to the dorsal nasal artery, which goes right to the eye. So in theory, if you plug this up, you can easily blind someone. Let's avoid that. How? Well, we understand that it becomes deep at the jawline, and it continues to go deep till about the lateral aspect of the iris, and this part naturally becomes more superficial. And this is where we're going to be placing this filler, is going to be around here, and this artery doesn't always stay locked here. Sometimes it can go a little lower, sometimes it can run a little higher, but it's generally in this position. So we want to avoid hitting that. So what are we going to do? We want to inject deep because we know that this area runs superficially. Okay, what's the other artery we want to miss? This infraorbital artery. This one runs right here. It runs deep and it's on the bone. It does not connect to the eye. How can I be safer with my injections if I also have a deep infraorbital artery here bed? Well, what you want to do is understand that there's a bony hub that protects it, and it protects it from on top, and then the arteries run down and up. So if you place your needles coming from this way, then you're definitely going to cause potential injury here. But if you're coming from the top and from the side, then you're going to likely hit that bony protective hub, and it's going to protect you. I also recommend aspirating for at least 10 seconds. Don't prime your needle prior. And if you have access to an ultrasound, that is your best bet for safety. This might be a recap, but in the last video, I did mention that you really want to place the products deep, and it's because you want to avoid hitting those superficial fat pads. If you place it in the superficial fat pads, these things are mobile, they tend to drop, and this is how someone could have cheeks looking good now, but in 6 months, they're all the way down here looking droopy. Place it in the fat pads that don't move. These are your deep fat pads. This is your deep medial and lateral SUS. That's where you want to go. If you're using a needle, hit the bone. If you're using a cannula, the first pop is in the superficial fat pads when you go through the skin, and then go again and feel the second pop. And that's whenever you're in the deep fat. If you feel that tends to, make the client a little queasy, or it's tender and it makes you hesitate in placing the product there, then take some lidocaine and numb that area. It'll make the experience much more pleasurable for the client, and you won't have as much hesitation in going deep, because that's where you need to go. Next, I'm going to cover landmarks here. The landmarks for a masculine face is surprisingly easier than a feminine cheek. I'm just basically looking at first the apex, which is the maximum light reflex. And to find that, you take the lateral canthus of the eye and you make a straight line down. And I did that with Stuart here. I made a line going directly down until I feel the bony prominence that starts changing on an angle. And that is my apex. I want to use the bone where it starts changing direction, and I want to volumize that area. Now I also have to be careful because I don't want to over volumizing it, and this is the trick. The trick here for the masculine face is to basically have a flat cheek, almost to the appearance where they don't have any filler, or you can get away with up to 3 millimeters of projection. 3 millimeters is not a lot. You just want a little bit of projection, and then after that, you're looking at the medial fat pads, where in most people, we end up losing volume here and here. And if I can get that restored to just bring it back to where it was before, without anything extra, then that's what I want. And it's going to wake them up, they're going to be happy, you're going to be happy, and then to finalize it, you want to finish it off with the tapering. Now, where should the tapering go? The tapering really depends on the face. Stuart's face and my face both have a natural upward trajectory with the zygoma, or the bone that's here. So that's where I'm going to follow. So if I were to do mine, I would place a bolus here, match this if I feel like I needed it, and then after that I would just taper it up oh so slightly on this trajectory. However, if they had a zygoma that was straight on and not tapered up, then I would taper it back straight. I would follow the natural anatomy of the face I wouldn't recreate anything abnormal or new in this area. I hope you guys enjoyed this free video. These are insights to how I treat my clients. If you're looking for something a little bit more detailed, I do have a Patreon below. You can click on that and I'll give you detailed information on how I treat my clients. Until the next time, take care of each other, exercise daily, and please be nice to absolutely everyone. Take care, guys.